All right, you've likely heard a lot about the surge in positive coronavirus cases in recent weeks, but what you haven't been told is that while there has been an explosion of new cases, especially in certain states, deaths continue to plummet. In fact, the number of daily COVID deaths is down 90% since peaking on April 15th. But that's not the only thing that caught our eye today. During an online Q&A, Dr. Fauci made a stunning admission about a COVID vaccine.
We're going to assume that there's a degree of protection, but we have to assume that it's going to be finite. It's not going to be like a measles vaccine. So there's going to be follow-up in those cases to see if we need a boost. We may need a boost to continue the protection, but right now we do not know how long it lasts.
Okay, here with what all of this means, Dr. Ramin Asqui, cardiologist and CEO of Foxhall Cardiology, and Dr. Stephen Smith, an infectious disease specialist who's treated so many COVID patients over the last 3 and 4 months. Dr. Asqui, let me start with you. What is going on here with what Fauci just said?
Well, I think he's laying crepe for the fact that I think these mRNA vaccines simply won't work. Last week, Moderna executives were reported in the Washington Post to have dumped $200 million worth of stock. They then the next day announced that they weren't going forward with a 30,000 patient phase 3 trial. It makes one wonder whether or not there are problems with their phase 2 trial, namely that the patients have had adverse effects. All the major platforms are based on this new and unproven technology for vaccines. So it's going to be very interesting. I think he's preparing for us not to have a vaccine, frankly.
Okay, so we needed a vaccine, correct, in order to get back to, quote, normalcy, Dr. Asqui. That's what we keep hearing. Yes?
No. The short answer is no, we don't, and no, we never did. What we need to do to get back to normalcy is to quarantine high-risk individuals, and then we need to get back to our lives. Probably not locking down accelerated the so-called herd immunity, which is not just our holy grail, but which is what's going to get us out of this epidemic like it's gotten out of us all out of prior epidemics over the millennia.
All right, speaking of which, we're trying to get Dr. Smith back on the line in a moment, but Dr. William Hazeltine gave this dire assessment of our efforts to fight the pandemic. Watch.
Herd immunity is a fantasy. It does not exist for these viruses. It's a fantasy and a dangerous fantasy. Even at best, it meant perhaps millions of people dying. Are we really that far back to the pre-antibiotic era?
All right, Dr. Smith, I think we have you there. What is he talking about? No herd immunity? It's worthless?
Herd immunity? No, herd immunity is worth a lot. That's how we deal with the most viruses, and we've dealt with viruses before we had vaccines.
We have a lousy connection. It's Dr. Smith, hold on a second. We have a lousy connection with you. I don't know what's going on at your house. Maybe it's rain, maybe it's lightning. Dr. Asqui, the trashing of herd immunity, even the president has kind of poo-pooed it. A number of times, like the herd. Oh, I love that little box. There he is on that box.
I think it's a mistake to trash it. The reality is that's the mechanism by which all vaccines work. It's the way we've gone through and conquered prior pandemics and epidemics. Herd immunity is real, and it's already occurring as we speak. Since Memorial Day, we've seen people get out and about. We've seen a rise in positive tests. But as you've seen, people aren't getting as sick, and death rates continue to drop. This is what you see in herd immunity. It's virology 101. It's first, second year of medical school.
Now, Dr. Asqui, one of our mutual friends says that we're going to end up like Sweden. But a lot of people don't understand, what does that mean? Because we didn't kind of let it roll. We didn't keep kids in school. Sweden did, at least the younger kids. But what does that mean we will end up like Sweden?
I think what our friend is referring to is the fact that slowly and surely herd immunity has developed. The virus, as it attenuates and mutates, becomes less and less problematic. Sweden was smart. They quarantined their most vulnerable, and they let their healthiest, least vulnerable individuals, namely children, continue their schooling. And that was much better for both the educational system and the health of their country. and their economy.
And Dr.
We're about 3 weeks behind.
Yeah, well, since you've treated so many patients over the last months, I want to get your reaction. I know you appeared with us last week, but I wasn't here. And the hydroxychloroquine study that dropped from the Henry Ford clinics, health system there, the mortality rate for patients on hydroxy was basically cut in half.
Yes.
It was, I mean, it just basically smashed back at all the doubters, all the critics. And your point is that we should take the hydroxychloroquine we have in our stockpile and perhaps consider giving it prophylactically to healthcare workers. Explain that.
Well, there are studies, and this is done in India routinely, where hydroxychloroquine is given in low doses as prophylaxis to protect high-risk individuals. In India, specifically, the protocols for healthcare workers. We now have a burst of infections in the southern states. A lot of this is due to people coming up from Mexico, and the way to protect first responders and other healthcare workers, I think, is very evidence-based, and it's to give them prophylaxis.
All right, Dr. Osby, thank you so much. Great to see you.